been joined by the Chief Health Officer to provide today's COVID update. And you'll also be hearing from a young 17-year-old person, Sailor, and her mum, Michelle, particularly Sailor's journey through the COVID experience, including hospitalisation and her experiences being on a ventilator. So the batting order will be myself, Sailor and Michelle, and then the Chief Health Officer. So yesterday there were 1,572 new cases of coronavirus in Victoria. One of those was internationally acquired. 1,571 were acquired locally. That brings us now to 19,861 active cases of coronavirus in Victoria. Very sadly, 13 people have lost their lives in the most recent reporting period to COVID-19. These were a man in his 50s, a man in his 60s, a man in his 70s, and two men in their 80s, all from the Whittlesea area, a woman in her 90s from Darebin, a man in his 80s from Hume, a woman in her 80s from Moonee Valley, a man in his 70s from Brimbank, a woman in her 70s from Banyule, a man in his 70s from Moreland, a woman in her 60s from Stonington, and a man in his 60s from Nillumbik. Can I take this opportunity of passing on our deepest sympathies to the families, friends and communities of those Victorians, and we pay our deepest sympathies and concerns to all involved. There are currently 705 Victorians in hospital with COVID-19. 146 of these people are in intensive care unit, and 92 of those are currently on a ventilator. Yesterday there were 79,200 tests processed, another daily record, and I want to thank every one of those tens of thousands of people for coming forward and getting tested. It is a very important thing to do to help us get ahead and turn this wave around. There were also 38,072 vaccines administered through state-run clinics, and many more than that delivered through the partnerships that we have in place with our GPs, our pharmacists and our other community providers. As of yesterday, 87.1% of the 16-year-old and over population of Victoria had had their first dose of a COVID-19 vaccine, and 60.9% had had their full second dose. As a result of the changing patterns of the COVID-19 in the Mitchell Shire, the Chief Health Officer has recommended that Mitchell Shire be released from its lockdown as of midnight tonight. The Mitchell Shire vaccination rates have really taken off over the last few weeks, and that's an outstanding effort by those communities. And whether it's unlinked cases whilst infectious in the community, they've all stabilised, and the public health team are confident that that outbreak is now understood and is being well managed, and that Mitchell Shire will come back into alignment with the rest of regional Victoria as of midnight. The limited reasons to leave home and the 15-kilometre travel radius will no longer apply in Mitchell Shire. As part of our drive towards 70 and 80% double dose, we are continually looking at how we refine and drive down to the community level our vaccination program. So over the coming weeks, we will be rolling out a local neighbourhood pop-up vaccine program which means Victorians will be able to get vaccinated in an increasingly vast array of places, be they gyms, be they local clubs, shopping strips, culturally safe locations in an increasingly diverse and really localised range of settings. The first of these neighbourhood pop-ups is opening today at Degani's Coffee in Mernda Junction in Melbourne's outer north, with more Degani's locations to follow, particularly in our high-risk local government areas that are the subject of our greatest attention. These neighbourhood pop-up models are designed to support Victorians to get access and vaccine, Pfizer in particular, in the most convenient, familiar and easy to deal with locations. And equally in culturally safe and protective locations for those Victorians who might need that further reassurance as to the need to come forward and get vaccinated. The pop-ups will vaccinate dozens of people over 2, 3, 4 hour periods of blitzes in those local communities, and they'll be delivered in partnership between the government, local GPs, local community health organisations, St John's Ambulance and a range of other discrete local providers. There are no bookings required at these neighbourhood pop-ups, and they will be in place with marquees, in shopping strips and, as I say, community centres, popular retail food and really localised areas that are familiar with and accessible to the communities we need to come forward and get vaccinated. Neighbourhood pop-ups are also planned with several neighbourhood houses in different communities and Foundation House who will host vaccine offerings for newly arrived migrants, refugees, asylum seekers and those people who so far have been marginalised from the mainstream vaccination program. Local engagement strategies are also part of this program, including, where it's suitable, door-knocking programs to make sure that everybody has access to vaccinations. Suburbs that are part of this program are going to be concentrated in those areas of concern, whether it be our mid and outer north, our western suburbs, and in the southeast. Particular focus on Broadmeadows, Craigieburn, Glenroy, South Morang and areas that continue to emerge as hotspots for more vaccinations. This all comes about as we've reached another milestone of 60% of Victorians now being fully vaccinated over the age of 16, and that's a significant achievement as we drive towards both 70 and 80% double dose and delivering on the national plan and Victoria's roadmap to reopen safely, carefully and sustainably. I'll now introduce Sayla. Sayla is a 17-year-old young person who's found herself severely unwell in Box Hill Hospital on a ventilator. She's here today with her mum Michelle to share their experiences and just to reinforce the message that everybody needs to get vaccinated as soon as you're eligible, and that is the best chance to avoid what Sayla and her family went through. So I might ask Sayla and Michelle to come forward. Then we'll perhaps take questions for them, let them get about their business, and then over to the Chief Health Officer. So Sayla and Michelle.
Thank you, Martin Foley and Brett Sutton, for inviting me to share my story. Hi, my name is Sayla, and this is my mum, Michelle. We are from the northern suburbs, from Hume, Broadmeadows. I'm 17 years old and a Year 11 VCE student, and last month I nearly died from COVID-19. In late August, my family got COVID from my baby sister's daycare. At the time, I was not eligible for the vaccine, and now I wish I was vaccinated before I got COVID. My whole family was sick. Everyone was coughing and suffering from aches and pains and a sore throat. We couldn't taste or smell. For me, my symptoms were worse, with coughing fits that left me breathless. As a family, we were more worried about my grandma, as she was older. We thought she'll be at risk the most. I thought I was safe, I was young, and COVID would usually affect the older people. I had moments where I felt good and was hopeful I was getting better. And then I would get bad again. In the second week of COVID, there's a risk of a relapse of symptoms. And this is where it got worse for me. My coughing fits lasted longer and I struggled to breathe. My whole family looked at me with worry and I would just brush it off and say I was okay. But really, I was scared and I was hoping I would get better. As I got worse, we had to call the ambulance. I knew that if I went with them, I would be alone. They took me to Box Hill Hospital, which was a 40-minute drive away. I decided to go to the hospital as I thought it was only a checkup and be home the next day. With the hope I would be home the next day, I sat alone in the ambulance and I had never been in an ambulance before. I said goodbye to my family. I was so scared and lonely. My health progressively got worse, and then one night I couldn't stop coughing. I was struggling to breathe. The day before, they said I had pneumonia. I had no idea what that was. I felt so many needles. I couldn't catch my next breath. There was so much commotion around me, and I didn't know what was going on. I was so scared, I was screaming, and I thought I was going to die. And then I felt nothing. That put me to sleep. They woke me up 9 days later. I had no idea what had happened or how much time has passed. I wasn't fully awake and I was hallucinating. I had a tube coming out of my neck. I couldn't move, I couldn't talk. I was scared to sleep again. I just stared at the ceiling and I was alone. There was so much machines around me, so many wires and needles, so much beeping, and everything made me scared. I was broken. None of this was fair. With each passing day, I slowly got better. I started breathing on my own, and 5 days later, I waved goodbye to the ventilator. My strength was coming back. I had to learn to walk again. I cried every day, but I worked very hard at my recovery so that I could be home for the AFL Grand Final, which I was. I spent nearly a month in hospital, and 15 of those days was in ICU. I'm so thankful to the team at Box Hill Hospital. They were amazing. I'm so grateful that I was gifted with life again, as I was close to death. There are a lot of people my age who think they're invincible and don't need the vaccine. They think they're young, they don't have underlying conditions. They won't be affected, but COVID almost killed me. I know that people in their teens and 20s haven't been eligible for as long, and the numbers are catching up and growing fast. But we're still the least vaccinated age group above the age of 12. I don't want anyone my age to have to lie in a hospital bed and tell their family, I'm sorry, I did not get vaccinated in time. I don't know what the lasting effects COVID will have on me. I'm still recovering. I'm not 100% with my strength yet. My mind is still fragile. My bruises are fading. I will have this scar on my neck for the rest of my life from the tracheostomy. At the time, I was the youngest person to be on ventilator because of COVID. I don't know now. There's still COVID in our community. There's still so many families right now being affected, and that makes me so sad. I'm so blessed that I'm home now with my family. I just want things to go back to the way it was. And when we have that chance, please don't wait anymore. If you can get the vaccine, please consider it.
Thank you for inviting us to share our story. It's still so sensitive when I hear Sailor talk about it. I'm still hurting from this experience because of COVID, and I'm so thankful that I have my daughter standing next to me right now. I admire her bravery and her resilience, and it's so sad to know that there are still a lot of families out there who are affected by COVID. When I got the call from the doctor to say that Sailor's health had deteriorated so rapidly and was getting transferred to the ICU and put on a ventilator, I was in shock. And I thought, how? Like literally, I just talked to her 2 hours ago. And we were talking about coming home in the next few days. And I said to the doctor, please, let me talk to her before you do this. And he said it's best that you don't. She is so distressed. And before that call ended, I heard her screaming. I don't know if it's my imagination or it's a mother's intuition, but I heard her screaming. The next 24 to 48 hours, Sailor was critical. It was hour by hour. Her lungs had filled with so much fluid, and there was little air for her to breathe. She needed a lot of help from the ventilator, and I wished that she had been vaccinated. But it was too late. She was already in ICU. I remember speaking to the doctor and I said, please, you need to save my baby. And he said, Michelle, I promise you I'm doing everything that we can. We are doing everything that we can. He said, at this moment, she is the most sickest person in this hospital. At this moment, she is the most sickest person in Eastern Health. COVID, without the protection of the vaccine, had done this to her. There was no other reason she was in ICU. Last week, she was in school, and next week, she was in a coma. At the same time, my dad became COVID positive, and I was so grateful he was fully vaccinated. My older son was becoming sicker. He was going through his relapse. He had high fevers and nausea. And I was so worried about him because he was unvaccinated. And then my husband started coughing up blood. He didn't tell me at first, but I found out. His coughs were so powerful it left him weak. He struggled to breathe. He struggled to lift his head up and even keep his eyes open. He didn't want to go to the hospital. We were so worried about Sailor, but he did. And again, I saw another ambulance take another one of my family members away to a different hospital. And I was like, come on, like who next, seriously? I wanted to drive to the hospital. I became irrational. I was broken. I wanted to be with Sailor, with my husband, but I couldn't. I was still so sick with COVID myself. I couldn't risk another person getting this. And I started to grieve. I thought someone was going to die, and it was much easier for me to prepare for a loss than to hope. I was watching COVID rip through every member of my family and hurt them, and it was so painful, and I couldn't do anything. I was alone. I was helpless. I was receiving so many messages of support from my family, my friends, my work buddies, my school community and religious community. And even we got a call from the Chief Health Officer himself, Sutton. Thank you for that call. And I'm so thankful for them as they helped me snap out of my helplessness, and I thought if they can hope, then I can too. And very slowly it got better. Sailor was responding to treatment. Her body was fighting the virus. I would call her bedside every night, and even though she was sleeping, the nurse would put the phone speaker near her ear, and I would talk to her. She wasn't awake, I don't think she heard it, but I spoke to her and did a bit of a podcast, and it was just my way of connecting with her. My husband came home from hospital after 3 days, and he got the all clear to continue his recovery at home. I got clearance from COVID, and I was finally allowed to visit Sailor. I was escorted to the COVID ICU. It was so daunting. I saw Sailor just lying there. She wasn't awake. Once the tracheostomy was done, and that's where they took the ventilator out of her mouth and they put it through her throat, they began to wake up Sailor. And we were so happy. But she wasn't. She was so scared and she was so sad, and it was a long way to go. She didn't understand what was going on. She woke up 9 days later. Thankfully, the team at Box Hill Hospital were amazing. They supported Sailor in her recovery. We're not actors. This is not a script. This is some paper so I can look at because this is so nerve-wracking. It's our story. Sailor wanted to share her story. She wasn't forced, and I admire her bravery. Maybe there will be anonymous people online who will try and make her feel bad for speaking out, but they should know that nothing will ever make her feel worse than what COVID did. We're all over this. I hate COVID. I'm done with lockdown. And soon we won't need it because enough of us will be vaccinated. We have the option to get back to some sort of normal, and the vaccine will protect us and provide reassurance to our family and our loved ones. I personally have seen how COVID has affected my family, from the fully vaccinated and unfortunately to the unvaccinated like Sailor. I honestly believe the vaccine protected my parents, and I'm so grateful they got it, and that one dose that me and my husband got had helped. And that says so much. My parents should have been the most at risk because of their age, but they were vaccinated and they were okay. And Sailor, she should have been the least at risk because of her age, but she wasn't vaccinated and she almost died. We don't know why she got so sick. We may never know why, but I do believe she wouldn't have been this sick if she had been vaccinated in time. Please, no family should have to go through what we did. No parent should have to see their child suffer and die. And almost die. Don't leave it until it's too late. Please consider the vaccine. Thank you.
Well, thanks, Michelle and Sailor. That was very powerful. Whilst they're up here, perhaps if there's any questions, we could ask them in the appropriate way. And thank you again, Michelle.
Appreciate it. Thank you.
Well done, Michelle and Sailor. That was really brave. How many family members all up?
8 of us. So it was me and my husband, and I have 4 children. So Sailor, an older son, and 2 younger children, plus my mum and dad.
So they were the only 2 that were fully vaccinated?
Yep.
You and your husband were partially vaccinated?
That's it.
So that's 4, and the other 4, nothing?
Nothing.
Okay.
What was it like watching them deteriorate and seeing your family member go through various symptoms? Can you...
It was probably the worst thing I've ever seen. You're helpless, and plus you're alone. No one can come and comfort you or nothing like that. You have to do this alone because you've got that virus. And watching that, it just hurts even more because they're going, you know, you don't know when to call that doctor, when to call that ambulance, you don't know. And you know that if you do, and if they get taken, they're alone and you can't see them. It's one of the worst feelings I've ever felt, just seeing them. And for me, it didn't make sense because I was just experiencing, you know, it wasn't as bad as what they had. And it didn't make sense why they got so sick.
Yeah, what were those different levels of deterioration throughout your family members? You said some were...
COVID's quite interesting because you think that you're better and then it goes worse. So there is that period of relapse. So at the start it was the coughing, the body aches and everything like that. With my husband, he was just coughing so much. It was too much. His body, you know, that's when the coughing, the blood came. So you just see it. And with Sailor, her coughing fits were lasting way longer. And after that, she'd have moments where she could not breathe and she couldn't catch that next breath.
And how did that differ from those family members that were vaccinated? What were their symptoms?
It was much more different. There was a big difference because my parents were vaccinated and they didn't have that breathlessness. It was only Sailor. So we did see that the vaccinated were much more protected than what Sailor was.
Yeah.
You walk out of here, someone says to you, I don't trust the vaccine, I don't need the vaccine. What do you reply to them?
It's up, they're entitled to their opinion, honestly, and it's up to them. It's not me to give, you know, to force them to do it. I'm just here to tell my story, and this is what happened to me. And I just hope that that person doesn't get what we had or experience what we did. It's up to them.
Can I ask Sailor a question quickly? Could you just tell us a little bit more about how you felt since you came out of the hospital, how you've gone getting back into your regular life from before and with school and stuff?
So when I came back home, I was very happy to be around my family, and recovery was very slow, but I got there.
And she's attending classes again. Just this week, she's gone back to attending her online classes. Her recovery, it's been amazing. I couldn't believe it. This just happened last month. And for her to be standing here right now, it's amazing.
How are you feeling now, Sailor? And thank you, you've been very brave to get up and speak to us all, but are you feeling back to 100%, or do you feel like there's still a bit of a lag of symptoms?
I'm feeling really better. I'm still fragile, like mentally, but I'm working on it.
What about the physical ongoing effects?
Physically, my strength is not there, but I'm working really hard.
We've got physio support with that are going to keep an eye on it. So it's not 100%, and we don't know when it will recover to 100%, but it's something that she also needs to work hard to achieve.
When you're in the hospital system, how many other young people did you see there?
I didn't see many. I was basically like the only one.
And how did that make you feel? You must have felt like, you know, this is predominantly a disease we see in the elderly people, so... Yeah.
We did. We had a bit of a giggle about it, and we did feel that maybe the nurses and the doctors spoiled her a bit because she was the youngest one there, and she was probably the only one that was called superstar all the time. But yeah, it was really daunting when you go into the hospital and I'm just there to see a 17-year-old and there's much older patients there.
So like, among your colleagues at school or among your friends, what's their general attitude towards the vaccine? What do they generally think about getting it?
They're very supportive. They did get the vaccine, which I'm very happy that they did, and yeah.
They got really shook up because it hit home for them. For a lot of people, we were the first family that they knew that got COVID, and especially in Sailor's school as well. She was the first, one of the students that was known and had rapidly deteriorated. So a lot of them did get a bit shaken up, and I think it did encourage a lot of them to get the vaccine as well.
You raise a good point, because COVID is it's a disease that you don't necessarily know anyone that does have the virus. So how has that changed things for you, and have you seen other people around you now contract it since? Or?
It's changed us in a big way, because even I was the first person I knew that got it. Before it was just numbers, it wasn't familiar to me, and I didn't have that story or that friend to relate to. So for us, we are very open to letting people know that we got it. It can be a bit of a thing where you get shame. You don't feel shame, but you're a bit shy to say that you got it. And I do want to share that we did get it, and I was very open about it. So it has changed us a lot. It's changed the people that we know as well. And yeah.
I guess what's your final message to people that are listening at home?
To get vaccinated. To avoid getting coronavirus, I'll say it's best to get vaccinated to protect yourself and the people around you.
Definitely. Yeah, I'm just glad to have my mini-me back. So it's awesome. Thank you so much. Appreciate it.
Thank you.
Thanks, Sailor. Thanks, Michelle. I did speak to Sailor and Michelle just before they were leaving hospital. What a brave story. What an important story. I think Sailor will do more for adolescents and young adults in terms of a vaccination message than I'll ever do, even with a couple of hundred visits to this podium, because it's a real story, and it's an emotional story, because these are lives completely upended by this virus, and the powerful reflections on what a difference vaccination makes is the key message that I would like to reinforce as well. Obviously, Sailor wasn't eligible for the vaccine at the time that she contracted COVID. That's reflected in everything we're seeing with this epidemic. It's reflected in everything we're seeing in hospital at the moment. So, of cases in hospital yesterday, 91% not fully vaccinated. Of those in ICU, the most unwell patients like Sailor was last month, 98% not fully vaccinated. So if you are fully vaccinated, you are effectively not allowing yourself to be in a position where you need ICU. All three vaccines now with Moderna in Australia, very effective, very safe, and will keep you out of ICU. So if you're one of those people who haven't yet thought about getting vaccinated, as Sailor says and as Michelle says, it's your choice. But who wouldn't advocate, as I have done tirelessly, for vaccines, knowing what a difference they can make in people's lives for all of us, and to get out of this damn lockdown. In terms of our current cases, about a third are in the northern suburbs, just over a quarter in the western suburbs, about a quarter in the southeastern suburbs, and 5% in the eastern suburbs, and just over 8% reasonably stable in regional Victoria. But we have seen more cases, including some increased cases in Baw, Greater Geelong, Greater Shepparton and Mildura. We've also seen a handful of cases in Swan Hill, very likely linked to Mildura. So we're asking everyone in Swan Hill, as we do everyone everywhere, be alert to symptoms and get tested if you have any symptoms. There's still very good testing going on in Mildura, so picking up those cases, which is fantastic. We do have a new mass testing site in Cranbourne that I mentioned yesterday, did more than 1,100 tests, so it's good to see numbers rising there. There's still capacity for more people to come through. And then on vaccination, further to the Minister's announcement, there are some other pop-ups that have continued to have great success. The Islamic Centre in Newport in its final week, just going through the second doses now. It's done more than 11,000 shots since it opened a month ago. It's been one of our most successful pop-up sites, really with in-language and culturally appropriate support to the diverse community in Newport and Hobsons Bay. And, we've spoken of the increase in vaccination coverage in those areas. It's really been very significant, and in no small part to that kind of engagement and provision of vaccines. So well done, and thanks from all of us, and we wish you well in your final days of being a pop-up site. Palm Plaza Dandenong's also done nearly 15,000 doses in under a month. That site's providing both Pfizer and Moderna, also accepting walk-ups. And it's really important. Dandenong's still behind the state average for both first and second doses, but again, really huge uptick recently, but still only at 81% first dose and 50% second dose. That's not enough to drive numbers down properly, so we encourage anyone of any age to come down and get your vaccine there, especially if you haven't started your course. And really for anyone across Victoria, if you've started your course, if your second dose is due, and some people may have had changes to their booking schedule or kind of missed out as the interval has changed in terms of recommendation, please follow up with your second dose. Again, that's a reflection from Michelle and Sailor. One dose, good protection in terms of severity of illness, but those two doses really, really strong protection, 95, 97+% protection against dying, against being in ICU. So please finish your course if you've had that first dose and you're due for your second one, even if you're late now. Never too late for your second course to complete that dose. Finally, one of our school pop-ups, Brunswick Secondary College, did almost 1,000 doses over the weekend. Well done there. More than a third of attendees born overseas there. And now, as the Minister said, we're bringing mini pop-up sites to local shopping strips and cafes, so there'll be much more ready access. So keep an eye out for things in your local area. It's never been easier to get the vaccine. It's probably never been more important. So if you haven't already, please step up, get vaccinated. Thank you.
Thanks, Brett, and thank you to Sailor and Michelle and her family for sharing that incredibly powerful story. So, happy to take questions.
Are these new ways of administering vaccines really a sign of what options open up when supply is guaranteed and is more plentiful?
Yes, I think that's a fair description. Now, into mid-October, with the Commonwealth program having commenced in February, we've now got enough certainty of supply, enough distribution points across state-run clinics. Victoria has delivered more vaccines than any other jurisdiction through its state-run clinics, our GPs, our pharmacists, our community health centres, and now with support from a range of those groups, we're able to really drive these locations down, particularly at the most at-risk communities, to that really local level. And the mini pops are all about making sure that we get those vaccine opportunities in your neighbourhood. And I'd encourage everyone to reflect on Sailor's story and do your bit, come forward and get vaccinated.
How much do you anticipate this will accelerate the vaccination program, and are you going to predominantly target areas of low vaccination uptake or high case numbers?
A bit of both, because the two tend to go together. It is about making sure that in those areas that are underrepresented in terms of the state average of vaccines, but overrepresented in terms of cases, that we drive the vaccine program and the other supports into those communities.
I know it's predominantly focusing on Melbourne's northwest, but are there any areas in the southeast?
Yes,
that are lagging
absolutely.
as well?
We nominated some of the locations in the southeast, and we're working through more of those, and there'll be more, because we don't want to stop at 70, we don't want to stop at 80. We've got the 12 to 15-year-olds racing along. The Commonwealth are considering applications and programs for what happens under 12s. We want to make sure that we drive this well into the 90s and make sure that as we deliver the national plan, that as we deliver the Victorian roadmap to safely reopen, that we don't stop and that nobody gets put in the position that Sailor and her family have been in. And we make sure that we look forward to Christmas and to 2022 with a whole new optimistic frame.
Why do you think Dandenong is so far behind?
Well, there's a range of issues. Firstly, younger, more diverse communities who became eligible for the vaccine later. And then there's the whole range of opportunities for points of distribution of the vaccine. The people of Dandenong, when given the opportunity, have come forward really, really strongly. People in the west, the people in the north have also done the same thing. It has been older communities that became eligible more earlier in the rollout, and now what we're seeing is, as we've finally got that really widespread localised distribution, those communities coming forward in great numbers. And I want to thank the people of Greater Dandenong, Cardinia and the south east more generally, but urge them to keep coming forward.
Your fellow Minister Sean Lean said this morning that he fully expects restrictions will be eased as soon as we hit that 70% double dose mark. Will you make the same commitment?
Well, I think you're misinterpreting what Sean said. I've taken the opportunity to see a few of the transcripts of that. Minister Lean was referring to the good work that our RSL friends are doing in regards to the delivery of poppies, and there was never an issue. But I can confirm, as Minister Lean did, that when we hit 70% double dose, the RSL, as the custodians of Remembrance Day, will be out there selling outside poppies, and when we hit 80% double dose, they'll be able to do so inside.
Do you want to make any kind of commitment on those wider restrictions then once we get to 70% as we near it?
Well, the roadmap is pretty clear, and as the Chief Health Officer indicated yesterday, he's open to those considerations when we get to 70 and 80% double dose, but we're not there. We're well on track, and the most important thing we can do is, if Victorians want to get there earlier, is to listen to Sailor, listen to Michelle, come forward, protect yourself, protect your family, and get us to those 70 and 80% double doses and beyond. As Michelle said, we're all over lockdown. The way in which we make sure we stay over it is to get to 70, 80 and beyond, come forward and get vaccinated.
So we are set to hit those critical milestones of reaching 70 and 80% about 5 days earlier though. So can you give Victorians any indication now where we could be coming?
Well, the indicative dates were released in the roadmap, and Victorians are really racing along. And as the Chief Health Officer has indicated, when the data is in a position to be interpreted, he's open to having a look at it. But it will all depend on the conditions at the time, and the sooner Victorians get double dosed for the vaccine that's available now very freely, is the sooner that the Chief Health Officer will be able to consider that.
We've seen that today is our deadliest day this year. It still doesn't compare to New South Wales' number of deaths throughout this Delta outbreak. What could be an explanation for that? And what is your response? 13 lives in 24 hours is a lot.
Yes, 13 lives, one life, 13 lives. Every life lost to COVID is a tragedy. People like Sailor, who came very close to losing her life. These are tragic human stories. There are families and there are communities grieving as a result of COVID losses. In regards to the lag between infection numbers, hospitalisations and tragically deaths, that runs somewhere between 10 to 14 days after infections. New South Wales, as the source of this current wave, got to those points earlier than the rest of the ACT and Victoria. So I'm not a clinician. I can't forecast how the change of transmission play out in communities, but I think we all have to brace ourselves for the sadly inevitable fact that there will be more fatalities from COVID.
Minister, dozens of premature babies are in isolation after the Royal Children's Hospital's neonatal intensive care was visited by an unknown infected patient. How can we better protect our hospital systems?
Well, I think the Royal Children's Hospital have come out this morning and made some public comments, and I want to thank the CEO and her team of clinicians and all of the great team at the Royal Children's Hospital. As I understand it, exactly what you've said, that unknowingly some symptomatic parents had exposed the neonatal intensive care unit. It wasn't the first exposure that the Children's Hospital have seen because of their high levels of PPE, because of their high levels of infection prevention measures, their isolation protocols, their support for, first and foremost, the young children in their care, their families and their staff. So far, the Royal Children's Hospital have done an outstanding job, and I think the measures that they've put in place, the next level that they've gone to for those, will make sure that they protect those kids, those families and their staff.
And you're absolutely correct. They've introduced rapid antigen testing for all parents and carers, but shouldn't this have been implemented earlier on, given the significant caseload we're seeing in the community?
Well, rapid antigen testing has been a feature of what the public hospital system has been dealing with, what hotel quarantine have been dealing with for some time. So I think the Royal Children's Hospital have done a really, really good job, and any suggestion that they haven't acted in a timely manner, I think is wrong and needs to be carefully reflected on. The Royal Children's Hospital have led the way in infection prevention and control in these acute environments, and they're doing an outstanding job.
So how do we strike that balance? Because several parents, as you mentioned, have tested positive to the virus, having visited over the last several years.
Well, first and foremost, get vaccinated. Take the advice of Michelle and Sailor, but through a whole range of measures, now that the Children's Hospital have gone to that next level of delivering rapid antigen testing, which has been not as freely as available as we all would have wanted, but now that the Commonwealth is in the process of changing those rules, now that we've taken it from a trial system to a whole new level, I'm confident that increasingly as we open up, whether it be in hospitals, whether it be in workplace settings, whether it be in high-risk industries, we will see rapid antigen testing part of the serial ongoing management of risk as we safely and sustainably reopen.
How much does a rapid antigen test cost?
It varies. It can vary up to, as a unit cost, and it's coming down all the time, up to about $20, as I understand it. There's dozens and dozens of them. The Department of Health will put up advice as to what's the best system to put in place for your workplace or for your domestic use. We're purchasing for the public hospital system, healthcare system, over 2 million initial tests. The rest of the whole of government will be delivering millions and millions more, and I would encourage, once the system becomes available from the 1st of November, industry more broadly to put it in place as part of their safe, sustainable reopening if that fits your circumstances.
Is it your expectation, whether it's through rapid tests or just through PCR tests, that frontline workers like paramedics and other frontline workers are getting that done now, getting regular testing through the week?
Well, they already are. So there's lots of high-level testing going on right across those high-risk sectors, aged care, still abattoirs and other high-risk settings, hotel quarantine, healthcare settings. The amount of regular testing that's going on is significant. It will become even more significant as rapid antigen testing finally gets the all clear from the Commonwealth regulatory agencies commencing the 1st of November.
Just on the scaling back of non-urgent surgeries, have public patients been prioritised for elective surgery?
Well, all clinical decisions as to who's prioritised for elective surgery and where are made in accordance with clinical advice. As we responded to your questions yesterday, we're now ramping up as the greatest need for clinical and hospital support is in those many, many hundreds of cases of COVID in our hospitals. As we saw in New South Wales earlier this year, And as we saw in Victoria in 2020, that has necessitated some changes in partnership with the private sector. It has necessitated prioritising Category 1 and Category 2A surgeries, and sadly the deprioritising of other elective surgeries and shifting some of those from the public sector to the private sector, all of which have decided on clinical advice from treating practitioners and surgeons.
There was a doctor on 3AW this morning who told Neil Mitchell that he'd been ordered to prioritise public patients. Are you aware of those reports?
Well, we're shifting public patients from the public sector to the private sector.
But to prioritise over private patients?
Well, we've got an agreement, we've got a national agreement that brings together the private sector hospitals and the public sector hospitals, and all of those priority decisions are made on clinical advice. If the public sector person is of greater clinical need, then of course they will be at the front of now a wider queue that takes in both the public and the private sector.
On aged care, Minister, or for Brett Sutton, how many aged care homes now have COVID patients, and of the residents at Embracia that died over the weekend, were they vaccinated?
I might have to throw to Brett, but the last report I saw, there was at least somewhere between 7 to 10 private residential aged care settings that had had some form of a COVID cases, and the very sad loss of life in that particular facility is amongst them. Overwhelmingly, I don't have the exact details for each site, but each report that I've seen is that as part of the very high level of vaccinations for private residential aged care, that nearly all of those sites were either fully vaccinated or partially vaccinated, both for residents and staff.
Just a quick one on vaccination shopping for those that are choosing their options. Health authorities aren't collecting a piece of COVID data which vaccine is more protective against hospitalisation, whether it be AstraZeneca or Pfizer. Is this something that we could possibly look into?
I might throw to Brett, who's the clinician and the Chief Health Officer. All vaccines work. All vaccines save you from the kind of story that we've just heard from Saylor and Michelle, and I would encourage anyone to get the vaccine that's available today, because that's the one that might save your life. But in terms of the relative science and which is most effective in what circumstances, I might throw to Brett.
No, the Minister's absolutely right. They're all very, very protective against hospitalisation, ICU and dying. And they've got their own uncertainty range in that regard, but they're in the high 90s for all 3 vaccines that are available in Australia. And again, the one you should get is the one that's available for you now. I got AstraZeneca, some of my family members got AstraZeneca and Pfizer when with Moderna available, whatever the booster shots might be, I'll be stepping up for whatever booster shots available. If Novavax is part of a booster system and that's the one offered to me, I'll step up for that. I think we rightly trust the TGA. It's got a very cautious, appropriately conservative approach to the regulation of all new medicines, including vaccines, and they take their time to look through all of the available data. They've got a really rich data set that's provided by the pharmaceutical companies in those assessments, and looking at the international evidence on effectiveness and safety from across the world. So when it comes to us as a recommended vaccine from ATAGI, it gives me absolute confidence that it's an appropriate one for any of us to take as recommended by ATAGI. So just step up and get the vaccine that's there for you.
Do you know much about those Embracia patients?
I understood that they were all fully vaccinated. So the issue is there's a real reduction in the risk of transmission when you're vaccinated, but it's nowhere near 100%. It's more like 60%. So you can become positive, you can transmit to others. That's what's happening in these aged care facilities. They need to take all of those other measures that we have really embedded, the use of PPE, the cohorting, the ventilation and all of the infection prevention and control measures that need to take place. But there are challenges with wandering in those settings. There are challenges with some very infectious individuals with coughing. So, that becomes difficult to manage, but it does, again, really reduce the risk of very severe illness for those individuals. But some of those aged care facilities got the vaccine very early on, February, March. So, again, we're all keen to hear advice nationally on the booster recommendations and those arrangements, and to roll that out as soon as possible. And I can imagine that aged care facilities, whether they're targeted as a high priority as aged care facilities, or whether they're just rolling through because it's been 5, 6 or more months for some of those, I think they'll be first in the queue to get that additional protection. Some of the evidence on booster doses is really, really encouraging, including that you've got 10 times the kind of immunity indicators with that booster dose. That is really positive news. And I think the Chief Medical Officer, Paul Kelly, or Brendan Murphy have spoken of the fact that the booster might be enough for a long time thereafter. Who knows if it's for life, but it'll be, potentially years after that booster dose that you've got that protection, and maybe do not need regular boosters, 6 to 12 monthly. That would be a terrific finding to come to as well.
On reopening, Brett, we're getting up towards that 90% first dose for 16 and above. Next one after that, next goal would be 90% for 12 and above. I guess how many more freedoms do you envision us being able to have when we get to that 90% 12 and above? And are you expecting to kind of release a new stage of the roadmap on what might be available, which I guess might act as an incentive for people as well? Yeah,
of course. I think we have to consider that. I fully expect that we can go further as we get higher vaccination coverage, whether that's 90% 12 and above, or whether it's 85% double dose. They're reasonable considerations to make with regard to further easing. Of course, we need to look at the international landscape there, how those highly vaccinated countries like Portugal and Spain and Ireland and Denmark and Iceland are doing, and by and large they're doing very well, and they've opened up even further as they've gotten to those very high levels. But we also need to see what challenges might be ahead, even at those high vaccination coverage rates, because Singapore's had 3,500 cases a day with a very highly vaccinated population. They've got something like 40 people in ICU, so with a similar population to Victoria, a much lower level of ICU admissions with that very high double dose vaccination coverage. So you can have high numbers of cases and protect your health system and protect people's health and well-being. So we just need to look at all of that evidence as we progress to those thresholds. But I fully expect we can and should go further with higher and higher coverage, which is yet another reason to talk about everyone coming forward to get vaccinated and getting that second dose.
Professor, can I get you to reflect on today's numbers? I know yesterday you said you were taking a cautiously optimistic approach. We saw a 5-day low. Numbers have picked up slightly, but significant deaths obviously recorded. So how many days do we need to track to see how we can...
Look, another couple of days, and I think I'd be extremely confident that we're on the downslope. We're probably on a plateau at the moment. Even though today's numbers are a little bit more than yesterday, it's well below the peak of 1,900 plus cases that we've seen previously. So I think, we're very likely to be headed down from here, but it'll be a bit of a bumpy numbers ride day to day. On deaths, as the minister's reflected, we see people who relapse, people who develop their severe illness a week, 2 weeks after they've been confirmed with COVID. So we will unfortunately see days of significant deaths. I'm also, pleased that we've seen a lower relative hospitalisation rate and ICU occupancy compared to New South Wales with similar cumulative confirmed cases. Good vaccination coverage of those most at-risk age groups, so 70 plus age group getting to the 95% first dose coverage is huge protection from hospitalisation.
Would you be comfortable to reopen with the current caseloads if they do continue to decline?
Yeah, I think we're on track for that reopening, absolutely.
Schools, Brett, how many schools at the moment are affected by COVID outbreaks or isolation? And secondly, have you got any more fine-tuning on that isolation policy for students and teachers? We were talking about that last week, I think.
Yeah, we have. We'll have more to say on it probably tomorrow. There have been over 30 exposures in schools. The data on transmission will come through over today and tomorrow and the next day. So a lot of those exposures, you don't know whether they've led to further cases because there's an incubation period, an average incubation period of 4 to 6 days before new cases might emerge. That'll be really important data for us to see what the effect of vaccination is for some of those students, what the effect of both the case and a contact wearing a mask. I suspect it'll really substantially reduce transmission, and it'll mean that we can have some confidence about, kids carrying on in school with their exams, with their studies, without needing to be super conservative about what our close contact definitions are. But there is some more data to come through on that through today and tomorrow.
I don't know whether this would be one for you or for the Minister, but websites are popping up that are offering people fake vaccination certificates. You can pay a bit of money, apparently it takes a few minutes for them to come up. Is that a concern for you, and what can be done against those, I suppose?
Of course it's a concern for me. We know that there are some highly motivated individuals who are trying to get around the system. They are a very small minority. Our behavioural survey data suggests that it's 4% or fewer people who currently say they wouldn't get the COVID vaccine. To me, that says there are 96% of people who have already declared that they're going to get it or are very close to coming to that determination. So those very small percentages of people won't change the landscape substantially, but they've found some very creative ways to try. I think equally our department, working with Service Victoria, are being very clever about how those certificates are going to be validated and not able to be counterfeited, but the Minister might have more to say on that.
Well, I concur with Brett's assessment. 96% of people want to do the right thing. I think more than that will ultimately come around. But why do it? Why fool yourself that you think handing over money to some crook is going to let you in to a venue when the easiest way is to go and get vaccinated, to protect yourself, protect that venue. We are opening up to the vaccinated community. People who choose to put themselves outside of that system, they take the consequences of that decision. Put yourself in the position of Sailor and her family. Why would you risk that for the sake of a false certificate? It is just beyond comprehension. Don't waste your money, avoid the crooks, go and get vaccinated.
Just on a mandatory vaccination, do we have any update on where things are at, if there's been significant uptake of that, or if there'll be shortage in sectors you perceive? Well,
there have been a significant uptake. Victorian community is roaring along, whether it's a consequence of the sort of stories that we've heard from Sailor and her family, people wanting to do the right thing, or people being motivated to come forward and get back to work. All of those are perfectly reasonable levers to come forward and get vaccinated. We are tearing towards 70 and 80% double dose. We won't stop there. And the higher the vaccination rates, as the Chief Health Officer has indicated, the better prospects of returning to a safe and sustainable reopening.
We did see teachers, sorry, just really quickly, we saw some teachers and nurses and, retaliate against it. So you don't foresee any shortages in sectors?
No, look, as Michelle indicated, people are free to make those kind of decisions. They are wrong choices, they are poor choices, they are choices that put you and your family and potentially your workmates at risk. Don't make those choices. Listen to the evidence, listen to the stories of what happens when COVID strikes in families, and listen to what that means in workplaces. Do the right thing by yourself, do the right thing by your community, your workplace, get us reopened, get vaccinated.
Brett, super quick, last one. What's the likelihood, or perhaps the timeline, when we reopen of every Victorian eventually catching COVID?
Look, it's difficult to say. Obviously, we're going to do everything we can to protect those who are not eligible yet for a vaccine, and some who won't be eligible in the longer term. So, there are good prospects for the TGA approving a vaccine for kids 5 to 11 years of age, maybe before the end of the year. That's not a certainty. As I said, the TGA will be cautious, conservative, very considered in that assessment. I'm not jumping to the conclusion that they'll approve a vaccine for that age group. But people who are not vaccinated, eventually everyone will get it. So, for the very young kids, we know that it's overwhelmingly mild disease. But, as Saylor demonstrated, there are adolescents, there are other teenagers who can get really significant illness. There have been 300 or more deaths in the US in adolescents and other kids. So, it's not a nothing illness for anyone. And I think over the course of another year, another 2 years, absolutely everyone will get it as we open up, because we're not going to hold back in terms of how we live our lives and move around when we're a fully vaccinated population, the fullest vaccinated population we can be. That means that there'll be really widespread transmission of this very infectious virus.
Sorry, just a quick one. You mentioned 4 Bore Shires and new hotspot. I think there's about 100 active cases there. Why have they not been sent into lockdown, and what's the trigger, considering it doesn't seem to be based on infections alone anymore?
Look, they had a big spike a couple of days ago with 31 cases in a day. It was known what the super spreading event was there. It was, household gatherings, and those households have then had subsequent cases, but they are largely linked. They are largely being identified in people who've been identified as primary close contacts and can quarantine. So we'll keep an eye on it, but it's more of a known entity. And from that very high number a couple of days ago, it's kind of trended down. Again, yesterday a bigger number, but mostly linked and mostly quarantining. But we'll keep an eye on it. Part of our considerations are how community health services, local health services are able to respond to that caseload and manage with the local public health unit support. But at the moment, it's relatively stable, and they will push on, as have lots of regional local government areas, to higher and higher vaccination coverage, which kind of stabilises the prospect of a really explosive outbreak.
Sorry, just one
last question.
Do we know how many cases in Mildura and Swan Hill since yesterday?
I think 24 in Mildura since yesterday, but Jerome went up there. There's good coordination. There's lots of support. I think they feel like it's getting under control. But again, still some work to do with vaccination coverage there. They've got good vaccination coverage, but for priority populations, including Indigenous Victorians in Mildura, still some work to be done. That's cracking on, and there's really good cooperation with the Victorian Aboriginal community-controlled health organisations there.
Professor, we obviously know about the NICU unit outbreak today, the Kookaburra ward, which was oncology 2 weeks ago, and the hospital has revealed that 3 other wards have also had exposures. How concerning is this?
Yeah, look, no one wants exposures in really vulnerable settings. I think, as the Minister said, those health services do everything they can. People wear appropriate PPE, so an exposure doesn't necessarily mean transmission at all. And of course, they can set the visitor restrictions accordingly. They're free to do that. We've got a kind of minimum set through the public health directions, but they can make them more stringent if they feel a requirement to do so. And indeed, as the Minister's referenced, use rapid antigen testing as they see fit, as many emergency departments do, as lots of other wards do. So, I think it's being managed very well, but the risk remains as long as we haven't got super high vaccination coverage. Thanks all.
Thank you.
Yeah.